Hi everyone, Dr. Mark here again, and today I want to post something a little different. Most of my videos are based on questions from my Ask a Vet column or articles I have written about health issues with dogs and cats. Some others cover some of the great dog breeds I have worked with. Today I want to talk to you about something that has a lot of pet owners concerned: the high costs of medical care for your cats and dogs. If you find this information useful, please follow and like this video so that YouTube will send it to more people. A new study shows that 8 out of 10 new pet owners do not realize how much it is going to cost to take care of their new pet. A lot of people want the pet to be part of the family and want high-quality care but end up being stressed out about the costs. Many pet owners I chat with on forums mention that they no longer have a dog or cat because they cannot keep up with the expenses. Food is part of it. Finding a person to care for their pet when they have to be out of town is a problem, but the main concern seems to be the high costs of health care. About a fifth of them cannot afford the diagnostics recommended, like X-rays or ultrasound. Some say they cannot afford vaccines or elective surgeries like a spay or neuter, and about 1 in 10 cannot afford a surgery even if it can save their dog's life. 20 years ago, a basic office call and exam costs about $20. Just based on inflation, an office call with a physical exam would cost about $38 now in 2025. That is far from the case. I often hear an annual exam of up to $250. Costs in the US have gone up 60% since 2014, and about 10% just in the last year. Why is that now so high? Honestly, it is because there are a lot of expenses like higher salaries, higher rent, and higher drug costs, but one of the big problems is that many veterinarians feel like they have to own the machinery to do everything. If they do not, and are not able to offer the services the dog and cat owners expect, they are told they are going to lose their business. Clients are going to find a better kept practice. There is not a lot I can suggest you do about this, as the basic office call charge is going to be set in stone for each practice. Everyone with a dog expects a lot more be done, so of course a lot of veterinarians are going to offer all they can. An annual exam will often include blood screening, which in the past was usually only done before surgeries, and many other procedures that used to be elective are now offered routinely. That basic office visit runs up to hundreds of dollars. One thing you can do is search for a vet on the outskirts of town or in a more remote rural area. One of the first vets I worked for, back when I was a student, did mostly large animal work and only saw dogs and cats at the end of the day when his large animal work for the day was finished. Not all of you are going to want a large animal vet as his priority is to the cattle, but his education, if not his experience, is the same as a small animal vet and his charges may be a lot less. Please call and check before going out. If it is something more serious, like an orthopedic surgery, they may refer you back to another veterinarian in the city. If it is something basic, they can take care of it. I have worked in many places around the world, and one thing I have seen is that anyone, no matter how poor, can afford a dog or cat. In the US, about 15% of the clients can afford to do everything, but many others will do what is suggested even if they cannot afford it. It does not matter, however, if you are not able to afford the best. Your pet will love you no matter what. A recent Gallup poll showed that about 70% of dog and cat owners delayed pet care because of the costs. That is not ideal, but it does happen a lot. No one has the right to condemn you or call you a poor pet owner because you cannot afford everything recommended. If you go in for an exam and a diagnostic procedure is suggested and you cannot afford it, you can decline. It does not mean you are not a good pet owner, it just means that you cannot afford the procedure at this time. Be sure to ask about payment plans. If you are a regular client and the veterinarian has seen your pet for routine services like vaccines, they are more likely to allow you to pay this off slowly, within a year. If this is the first time you have seen them, they have little interest in financing you, as you may never show up again. I am not suggesting you go to the pet store and buy homeopathic remedies instead of seeing a vet. You should listen to your veterinarian's suggestions, but if you cannot afford the care they suggest, that does not mean you need to waste your money searching for one of the placebo cures. The placebo effect only works in humans. If you take your pet to the vet and they point out that your dog needs a dental cleaning because of periodontal disease, you should do it if you can afford to do so. If you cannot do so, we do understand. If you can afford it, there are also great AI apps available that will allow you to examine your pet every week. The apps can pick some things early, and if they cannot deal with it, they will send you to a veterinarian for a more thorough hands-on exam. If you want to read my article on what AI can do for your pet, and what it cannot do, you can find it at the Parade Pets website at https://paradepets.com/petnews/how AI can recognize sick pets early. If you do a search, you will see that there are a lot of good articles from the AI producers, but they are certainly not going to tell you what they are not able to do for your dog. Some veterinarians are now told that if a client cannot afford a procedure, they should not even have a dog. That is not true. Before I go, I want to discuss my Ask a Vet column at pethelpful.com. If you have any questions about your dog's health care or about any of my articles, you can contact me at that website. They do not always get the question to me right away, so if your pet needs help immediately, you should contact your local veterinary emergency clinic. The other thing that I would ask you to do is like this video so that the YouTube algorithm will rate it higher and include it on more feeds. Most of the page views we get are from the video being clicked on when it shows up on someone's feed. Even if it is searched for in the exact words that are used in the title, YouTube is not going to show it unless it has had thousands of views. Please follow me so that I realize this is helping pet owners, and I will release more videos. If you have any ideas for videos on information you need, please leave a comment and let me know. I do not always have time to make new videos, even when they are helpful, but I will do my best.